Have you ever heard someone say, I'm so OCD, just because they like things neat or organized? The truth is, that's not what OCD really is. Obsessive compulsive disorder is a serious and often misunderstood mental health condition that affects millions of people worldwide. Well-known individuals, including Howie Mandel, Lily Singh, Camilla Cabello, and David Beckham, have all openly shared their experiences with OCD, helping reduce stigma and encouraging others to seek help. Today, we're going to discuss what OCD really is, how it's diagnosed, what causes it, the treatments that work, and why recovery is absolutely possible. OCD stands for Obsessive-Compulsive Disorder. It's a mental health condition characterized by two main components, obsessions and compulsions. Obsessions are intrusive, unwanted thoughts, images, or urges that create significant anxiety or distress. Compulsions are repetitive behaviors or mental acts performed in an attempt to reduce that anxiety or prevent something bad from happening. Although performing the compulsion may provide temporary relief, it actually strengthens OCD over time by reinforcing the cycle. The DSM-5-TR provides specific criteria clinicians use when diagnosing OCD. A person must experience obsessions, compulsions, or both. These symptoms need to be time-consuming, often taking more than an hour each day, or cause significant distress or impairment in work, school, relationships, or other important areas of life. The symptoms also can't be better explained by another medical condition, substance use, or another mental health disorder. Everyone experiences intrusive thoughts from time to time. OCD is different because the thoughts become persistent, distressing, and difficult to ignore. Obsessions are not simple worries. They're intrusive, unwanted thoughts, images, or urges that repeatedly enter a person's mind despite attempts to dismiss them. Common obsessions include fears of contamination, accidentally harming someone, making a mistake, needing things to feel just right, or having disturbing thoughts that go against a person's values. One of the most important things to understand is that people with OCD usually recognize these thoughts as unwanted. The thoughts don't reflect who they are, they're a symptom of the disorder. Compulsions are behaviors or mental rituals that people feel driven to perform in response to an obsession. Examples include excessive hand washing, checking locks or appliances repeatedly, arranging items until they feel just right, counting, repeating phrases silently, or seeking reassurances from others. The purpose of the compulsion is not enjoyment, it's reducing anxiety. Unfortunately, while compulsions may help someone feel better temporarily, they actually strengthen OCD by teaching the brain that the ritual was necessary. OCD doesn't look the same for everybody. Some people experience contamination fears and excessive cleaning. Others struggle with checking behaviors such as repeatedly making sure doors are locked or appliances are off. Some experience ordering or symmetry compulsions, while others still struggle primarily with intrusive thoughts involving harm, morality, religion, or relationships. The specific content of the obsession varies from person to person, but the underlying OCD cycle remains the same. One of the best ways to understand OCD is to understand the OCD cycle. It usually begins with an intrusive obsession. That obsession creates anxiety or distress. The person then performs a compulsion to reduce the anxiety, and they experience temporary relief. But because the relief follows the compulsion, the brain learns that the ritual worked. The next time the obsession appears, the urge to perform the compulsion is even stronger. This is why OCD tends to become more severe over time if left untreated. The goal of treatment is to break the cycle. There isn't one single cause of OCD. Researchers generally explain OCD using the biopsychosocial model. Biological factors include genetics, differences in brain circuitry, and neurotransmitters such as serotonin. Psychological factors include temperament, perfectionism, intolerance of uncertainty, and certain thinking patterns. Social and environmental factors such as stressful life events, family dynamics, and learning experiences may influence how OCD develops and is maintained. Usually, it's a combination of factors rather than a single cause. Several factors may increase the likelihood of developing OCD. Having a close family member with the OCD diagnosis increases risk. Differences in brain functioning and certain personality traits, such as perfectionism or strong need for certainty, may also contribute. Stressful life events sometimes trigger or worsen symptoms. It's important to remember that risk factors don't guarantee someone will develop OCD, they simply increase the likelihood. OCD is diagnosed through a comprehensive clinical evaluation. A mental health professional conducts a detailed interview about symptoms, their impact on daily life, and how much time they will consume. Clinicians compare symptoms with the DSM-5-TR diagnostic criteria and consider whether the condition better explains the symptoms. Standardized assessments such as the Yale-Brown Obsessive-Compulsive Scale or the YBOCS may also be used to measure symptom severity. There isn't a blood test or a brain scan that diagnoses OCD. The encouraging news is that OCD is highly treatable. The treatment with the strongest scientific support is exposure and response prevention, or ERP. ERP gradually helps people face feared situations while resisting the urge to perform the compulsions. Over time, the brain learns that anxiety naturally decreases without performing the ritual. Cognitive behavioral therapy can also help people identify and challenge unhelpful beliefs that fuel OCD. Medication, particularly selective serotonin reuptake inhibitors or SSRIs, can be very effective, especially when combined with therapy. Many people benefit from using a combination of these approaches. Living well with OCD doesn't mean never having another intrusive thought. Recovery is about changing your relationship with those thoughts and learning not to let OCD make your decisions. Many people benefit from staying engaged in therapy, practicing ERP skills consistently, building a strong support system, focusing on their values rather than their fears, and recognizing progress instead of expecting perfection. Recovery takes time, but meaningful improvement is absolutely possible. OCD does not define who you are. Many successful people have spoken publicly about living with OCD. Howie Mandel has openly discussed his lifelong experiences. Lily Singh and Camille Cabello have shared their own struggles, as has David Beckham, who also described his OCD behaviors and how they affect his daily routines. Their stories remind us that OCD doesn't determine someone's intelligence, talent, or ability to live a meaningful life. With appropriate treatment and support, people with OCD can thrive. Let's clear up a few common myths. Myth number 1. OCD is just about being neat. In reality, many people with OCD aren't concerned with cleanliness at all. Their obsession may involve harm, morality, relationships, or countless other themes. Another myth is that people with OCD could simply stop if they wanted to. Compulsions are driven by intense anxiety, not preference. And finally, OCD is highly treatable with evidence-based care. Many people experience substantial improvement. If someone you care about has OCD, your support matters. Listen without judgment. Encourage treatment rather than offering repeated reassurance. Try not to participate in compulsions or rituals, even if it feels helpful in the moment. Be patient because recovery takes practice. Most importantly, remember that the person is not their OCD. If obsessive thoughts or compulsive behaviors are taking up significant time, interfering with work, school, relationships, or causing considerable stress, it's time to seek a professional evaluation. The earlier treatment begins, the easier it often is to interrupt the OCD cycle. Reaching out for help is not a sign of weakness. It's an important step toward recovery. Let's review what we've learned. OCD is a real mental health condition, not simply a preference for organization or cleanliness. It involves a cycle of intrusive obsessions and compulsions that can become stronger over time. The good news is that OCD is highly treatable, especially with therapies like exposure and response prevention, cognitive behavioral therapy, and, for some people, medications. If you'd like to learn more, download my free OCD educational handout from my Shopify store. And if you enjoy evidence-based mental health education, follow The Quiet Mind for more videos covering mental health diagnoses, DBT-informed coping skills, psychology, and evidence-based treatment strategies. Thanks for watching, and I'll catch you in the next one.